Good afternoon, everyone. I'm Boone Lockard, VP of Clinical Services here at VGM. Today, our guest is Rob Stevens. Rob is the Global Service Leader for Sleep and Respiratory Care with Philips Healthcare. Welcome, Rob. We're happy to have you here today.
Thanks, Boone. I'm excited to be here today and talk to you a little bit about Philips Sleep and Respiratory business.
Well, let's get this kicked off. And I actually know the answer to my first question, but it's one I still hear from our members, your customers. Is Philips Respironics exiting the U.S. market?
Thanks for asking that. And I can tell you, just in the few months that I've been here, I've heard this question a couple of times too, right? So what you're asking totally resonates with me. But what I can say to you, and I just want to be absolutely crystal clear with you, with customers, with patients, and everybody listening to this, Philips is absolutely in this business. We're here to stay. And, we look forward to returning to the U.S. market and continuing our ongoing sales, service, and support of sleep and respiratory products. It's not surprising that you asked the question because over the last few years, there's no surprise that Philips has been challenged, right? And Philips challenges has translated into customer and patient challenges. But we're absolutely committed to serving the patients. And we are continuing to make investments, right? We're continuing to make investments so that when we do return to selling in the U.S. market, that we're stronger and better than we ever have been. And that's our commitment to the market. It's also true that Philips has had to make some difficult decisions in terms of some product discontinuance. And we trimmed the portfolio primarily for the reason to focus on two key priorities. One was the recall activities in order to remediate the products. And two was to focus on the consent decree between the company and the FDA in order to complete the necessary steps in the consent decree so that we can return to the U.S. market.
Well, we talked a little, or you referenced priorities here. Let's take a quick dive into current priorities. Can you elaborate on what you are selling now and then how you will return to selling sleep and respiratory care devices?
So what we're selling right now is what we call patient interfaces. It's really the masks that go on the devices, right? And both for in-home care and hospital care. And so, like I said, we're continuing to make investments, right? And so one of those investments that we're making is continuing with our research and development team to research, design, develop, enhance new patient interfaces, new masks for new clinical settings, new opportunities for our customers and the patients that they serve. Regarding how we're going to get back into selling in the U.S. market, it's really two things, as I indicated previously. One is completion of the recall, getting through that. And the second is the steps indicated from the consent decree with the FDA. The good thing about the consent decree is that it's like a roadmap, right? It's like a treasure map. And so we know very clearly, like the rules of engagement between Philips and the FDA is very detailed, extremely detailed. And so we know exactly all the steps that we need to take and that we have been taking because this has been a multi-year journey, right? This doesn't just happen overnight and we still got work to do, but it provides a very detailed map of how we get from the beginning of the consent decree to the completion of this consent decree so that we can return to sales of the devices in the U.S. market.
Anything more to add on what that consent decree means for the U.S. customer base?
What this means for the U.S. customers is that, as I previously mentioned, we're continuing to focus on selling the patient interfaces or the masks that come with the devices, the consumables and accessories that come with the devices, as well as continuing to provide service and support for those devices, whether it's phone support or our bench repair if there's a hardware change or something of that nature. Right now, right, in addition to doing that, we are completely focused on the consent decree. We are absolutely focused and will continue to demonstrate compliance towards the FDA's quality system and completion of those activities. Outside the United States, we are selling, in addition to the things that I previously described for the U.S. market, we are also selling devices. But again, we have to work with each one of the regulatory bodies in those countries, and it's really handled on a market-by-market case of what we can and can't do. again, I just want to continue to reiterate that we are 100% focused on achieving a successful outcome with the FDA following the consent decree so that we can return to selling in the U.S. as soon as possible.
And I think the market can echo that. And you mentioned the recall. We haven't talked about that yet. Where does the progress of the recall currently stand?
Well, I'm super proud to let you know, like, we're more than 99% complete, not just in the U.S., but in the whole world, right? So all of the more than 99% of all the registered actionable devices, CPAP and BiPAP therapy devices have all been remediated around the globe. And, our priority is to continue to find and locate the remaining ones and complete that activity as soon as possible.
And based on that progress, this is another big question. Do you have any idea when you can re-enter the U.S. market?
I wish I had a crystal ball. I think I'm not the only one, right? Like I was saying, it's somewhat of it's like a map, right? It's a step-by-step map. Sometimes those steps are short in distance. Sometimes they're a little bit longer in distance. And so while we know each one of the steps that we need to take, the time to complete those, some takes longer than others. So it's a little bit too early to say exactly right now, but I want you, your listeners, our customers to rest assured that we have an entire student body shift at Philips focused on completing those steps as quickly as possible, but doing it in the right way so that it's sustainable and that we meet the quality commitments and managing the quality management system inside the company in order to make sure that it's done in a sustainable way. So as I said, right, the roadmap's very clear. We know exactly all the steps. We're working hard and tirelessly around the clock in order to complete this with as fast as possible, but with also a high degree of effectiveness. And as soon as we get the green light from the FDA, we'll be ready and back in the United States.
Awesome. And beyond the recall and consent decree, you mentioned the team is focused on improving the customer experience. Is there anything that you could share that you're working on, and how will that impact your customers who are listening in today?
Boone, for me, it's really simple, right? It's very simple in terms of what we need to do, right? Which is deliver a better support for our customers and the patients that they're trying to serve. Now, the complexity of it, right, is to do it millions and millions of transactions, right? Because you're talking about millions and millions of these devices out in our customers and being used by patients around the globe. And so we're focused on a lot of different initiatives, and we're making a lot of investments. That was one of my answers to the very first question, right? We're making investments now while we're doing the remediation and the consent decree so that when we do re-enter the U.S. market, like, we're better than we ever have been. And so we're working on really across the spectrum, thinking end to end, the customer journey and customer experience, from order entry to telephone support, to product support, to repair services. And one of the things that we know is that we need to streamline those processes across that end-to-end spectrum and make sure that we are doing everything that we can in order to get customers' problems and questions addressed quickly, accurately, and right the first time. During the last few years, right, a number of those projects did get kind of put on the back burner because we were so focused on the remediation and the consent decree. And so we're re-energizing those right now. But one of the big important steps that I think that we took recently was around redefining our service policy. And that service policy provides several options to our customers in terms of if they have a device that needs to be repaired, how they would like to do that, right? So in one instance, they could get the unit repaired. In another instance, if it's an aged system, they may want to have fair market value if we can't repair the system quickly enough. Or we might offer a warranty extension. And so we've outlined this service policy that provides very clear direction to our frontline agents so that when customers have these requests, that we're immediately able to provide answers to them and give them options.
With everything else going on in the background with regulatory bodies and agencies, from an internal perspective, how did you all decide which improvements your team would start working on first?
So I think the best thing to do is listen to our customers. And so that's one of the things that we did was, we just asked a lot of questions. And even a couple of months ago, I was at a trade show in Dallas where I got to talk to a lot of customers. And so between that, as well as the team had done some extensive market research to identify where are the biggest pain points for our customers and the patients that they're trying to serve in order to provide a higher level of service. And so, as an example, one of the areas that our research stated in terms of looking at our current existing support models was improvements to the order placement. And so when customers place orders, we should be in a position to ship those products out within 48 hours. Unfortunately, some of our ERP systems and back office IT systems and systems connected to our supply chain weren't all speaking with one another. And so at times there would be interruptions in terms of, hey, the device isn't shipping. How are we proactively communicating with our customer? What is the new expected delivery time? And just keeping the customer and their patient informed when they place the order. And so what we've been working on is several different projects to tie the IT systems together, both from our front end order entry all the way through our supply chain, so that we can provide immediate response to our customers and ideally proactive response to our customers. This product shipped, here's the air bill number. The product didn't ship, but based on supply chain planning, your device or your patient interface will ship, in 10 days. And then 10 days later, we provide the tracking information. Our next step is to leverage that into a self-help tool so that a customer or a patient can also log online and get immediate access themselves without having to call into Philips and talk to a representative. Listen, we know that DMEs are being asked to do more with less. That's just the way the world runs today, I think. And so we're taking steps in order to improve information access and availability so that we can speed up time to execution and answers to questions so that DMEs can focus on what they need to focus on, which is taking care of their patient community.
Sounds very promising. Is there anything else that your team's focused on beyond that? So obviously there's a lot of work to go into that, the operation side from an internal perspective. Anything else to add to that, though?
Thanks for asking that question, Boone. It's one of the areas that I take very personally, being in service for over 3 decades myself, and actually being in the field repairing equipment myself personally. So I take a lot of pride in fixing items right the first time and doing it quickly and doing it with a high level of quality with always patient and customer satisfaction in mind. But right now at Philips, it's taking too long. And so we focused on a number of different areas in order to improve that repair cycle time. One, we are partnering deeply with our supply chain to ensure that we have better forecasting of materials, that we have improved logistics, better planning, and better identification of potential supply chain constraints so that we can look forward and plan around those. Also, we're working closely with all of our repair facilities around the world to make sure that they have the documentation, training, and information that they need in order to execute the repair as quickly as possible. And then lastly, again, goes back to the previous story around order management. Our IT systems, various IT systems, aren't talking to one another. And so if you have a patient that calls in or a customer that calls in wanting to know the device, if the device is in transit, if it's in the middle of the repair at a repair facility, we may or may not have all that information readily available at our fingertips. And so the frontline agent would then have to go and do some research and get back to the customer or the patient with an ETA on that repair. And so, again, we are connecting our various IT platforms and systems, both Philips and our authorized repair centers, so that we can have more fluid and a better flow of information so that we can provide a more timely response back to our customers and to their patients so that we know and have a better ETA on equipment repairs.
That's great. And it's clear you all have been very busy and we've tackled a lot here in this conversation. Is there anything else so that you want to make sure our listeners walk away with here today?
I'll kind of finish this with where I started at the beginning, which is Philips is here to stay. We're not going anywhere. We are dedicated to this business and we are 100% committed to it. And so we are going to finish this remediation. We are modernizing our quality management system. We are working with the FDA, and we will return to the U.S. market stronger and better than before. If any of your listeners want to have more information, we can put a web link up on this video that they can connect to get more details of any of the discussions that we've had today to understand a little bit more in depth, as well as if they wanted any information. We have some amazing tools on our patient interface and masks that your customers may be interested in, that our customers may be interested in. So I would like to share those two web addresses on this video so that they can understand where we're at with the consent decree, as well as if they want access to any of these automated tools for mask selection or patient interface.
Rob, we appreciate your time here today. Thank you once again for jumping on with us and providing some clarity around what's going on there in Pittsburgh and with Philips, and it's truly appreciated.